Welcome. Today we will discuss adenocarcinoma of the lung, the most common type of lung cancer. We'll explore its features, subtypes, mutations, and staining patterns to ensure accurate diagnosis and treatment decisions for patients. Let's begin. Adenocarcinoma of the lung originates from glandular cells in the lung's airways. It demonstrates diverse architectural patterns and can have multiple patterns within the same tumor. The World Health Organization classifies it into different categories based on histological patterns, aiding in prognosis and treatment decisions. Advancements in molecular pathology have revealed distinct molecular subtypes of adenocarcinoma with significant implications on treatment decisions. These subtypes include KRAS mutations, EGFR mutations, ALK rearrangements, ROS1 rearrangements, and others. EGFR mutated tumors, for instance, are highly responsive to tyrosine kinase inhibitors, TKIs, such as erlotinib and gefitinib. ALK rearranged tumors, on the other hand, respond well to ALK inhibitors like crizotinib. These targeted therapies have revolutionized the treatment landscape, leading to improved outcomes for specific molecular subtypes. Intratumoral heterogeneity, defined as the presence of genetically distinct subclones within a tumor, poses a significant challenge in managing adenocarcinoma of the lung. It contributes to the development of resistance to targeted therapies and can lead to disease progression. Understanding intratumoral heterogeneity is crucial in predicting prognosis and developing effective treatment strategies. Techniques such as next-generation sequencing and single-cell analysis play a prominent role in unraveling the complex genetic landscape of adenocarcinoma and identifying potential therapeutic targets. Numerous key genetic mutations have been identified in adenocarcinoma of the lung, each with its prognostic and therapeutic implications. EGFR mutations, occurring in approximately 15 to 20% of patients, are associated with improved response to EGFR-targeted TKIs. Other mutations, such as KRAS, STK11, and TP53, are associated with poorer outcomes and limited therapeutic options. Comprehensive molecular profiling is now an essential aspect of diagnosing and treating adenocarcinoma. Identifying specific genetic mutations allows for the administration of targeted therapies tailored to the individual patient. Immunohistochemical staining plays a vital role in supporting the diagnosis of adenocarcinoma of the lung. Several specific markers are utilized to differentiate adenocarcinoma from other lung cancer subtypes and non-neoplastic lung conditions. Markers such as TTF1, thyroid transcription factor 1, and napsin A are commonly used to confirm the pulmonary origin of a tumor. Additionally, the expression of markers such as CK7, cytokeratin 7, and CK20, cytokeratin 20, can help distinguish adenocarcinoma from other types of lung cancer, such as squamous cell carcinoma. Differential diagnosis plays a crucial role in accurately identifying and classifying adenocarcinoma of the lung. Several lung-specific markers are employed in combination with other histological features to differentiate adenocarcinoma from other entities. Markers such as surfactant proteins, SPA and SPB, and mucin stains, MUC1 and MUC5AC, are utilized to confirm the lung origin and support the diagnosis of adenocarcinoma. These markers are highly specific and aid in distinguishing it from metastatic tumors originating in other organs. Bronchoscopic biopsies serve as a valuable tool in obtaining tissue samples for the diagnosis of adenocarcinoma of the lung. Various techniques can be employed during bronchoscopy, including bronchial brushings, forceps biopsy, transbronchial needle aspiration, TBNA, and endobronchial ultrasound-guided biopsy, EBUS. These minimally invasive procedures allow for adequate tissue sampling, thereby facilitating accurate histological examination and molecular profiling. They are particularly beneficial in cases where surgical resection is not feasible or carries a high risk. Radiologic assessment plays a crucial role in the staging and follow-up of adenocarcinoma of the lung. High-resolution computed tomography, HRCT, imaging is the gold standard for initial evaluation, identifying the tumor's size, location, and possible involvement of mediastinal lymph nodes. Positron emission tomography, PET, scans, combined with CT, PET/CT, provide additional functional information, enabling the detection of distant metastases, lymph node involvement, and assessment of treatment response. These imaging modalities aid in determining the optimal stage of the disease and monitoring treatment efficacy. Adenocarcinoma of the lung can occur in young non-smokers, presenting unique challenges in diagnosis and treatment. Several risk factors, such as environmental exposures, genetic predispositions, and second-hand smoke, contribute to the development of this disease in this specific population. Histologically, adenocarcinoma in young non-smokers may exhibit distinct features, such as a higher frequency of EGFR mutations. Recognizing these differences is crucial to provide appropriate care and improve outcomes in this subgroup of patients. The era of personalized medicine has emphasized the significance of predictive biomarkers in tailoring treatment strategies for patients with adenocarcinoma of the lung. These biomarkers, including genetic mutations and protein expression profiles, allow for individualized therapy selection and optimization. Tests such as fluorescence in situ hybridization, FISH, PCR-based assays, and NGS help identify specific mutations and gene rearrangements. Alongside immunohistochemical staining, these tests enable the identification of patients who are likely to benefit from targeted therapies, ultimately improving patient outcomes. Despite the remarkable success of targeted therapies, resistance mechanisms inevitably develop in patients receiving treatment for adenocarcinoma of the lung. Evolution of secondary EGFR mutations, MET amplifications, and histological transformation are some of the mechanisms contributing to therapy resistance. Understanding these resistance mechanisms is crucial for developing new therapeutic approaches and improving treatment outcomes. Ongoing research aims to identify innovative strategies, such as combining targeted therapies, immunotherapy, and exploring novel treatment targets, to overcome resistance and prolong patient survival. The field of oncology is continuously evolving, introducing exciting therapeutic approaches for advanced stage adenocarcinoma of the lung. Immunotherapy agents, such as immune checkpoint inhibitors, ECs, have proven to be highly promising, providing durable responses in patients. Additionally, novel targeted therapies, including RET inhibitors, HER2 inhibitors, and KRAS inhibitors, are currently under investigation, showing great potential in clinical trials. These emerging treatment modalities offer hope for patients with advanced stage disease, opening new avenues for more effective and personalized treatment options. Adenocarcinoma of the lung is a complex disease with diverse characteristics. Proper diagnosis and treatment require knowledge of histological features, genetic mutations, and biopsy techniques. Personalized medicine and emerging therapies offer hope for better outcomes and longer survival. As future healthcare professionals, understanding and contributing to this field is vital.